Good morning. Today's topic is Chain of Health, a blockchain-based access control protocol for IoT-enabled healthcare options application. My name is Ayush Badheka. I'm a student at Concordia University, Masters of Engineering Information System Security. Student ID 40251378, and this is a paper presentation for the course INSE 6170. We start with the introduction. The integration of Internet of Things and blockchain technology has opened up new horizons in the healthcare application. Yes, pretty indeed that yes, IoT and blockchain technology has made it very secure to access all your healthcare related applications from one particular place and without the problematic situations of your data being tampered by any external entities or tampered by anyone, which might create a problem for your healthcare options to be tampered by anyone. You get accurate data nowadays related to any particular applications or internet technologies you use when it comes down to your healthcare. As healthcare is one of the most biggest prominent particular thing which is needed to be safeguarded as much as we can, because it is basically related to our own particular private health. When it comes down to the information we provide, it's basically every particular information internally and externally of your own self that is being provided within that particular healthcare applications which you we use. There are many healthcare applications which people have been using over the course of a time, and every healthcare application is made with such a particular base wherein it is supposed to be secure and made sure that the integrated data within the user's profile is not being leaked out to any particular entity externally apart from the ones who are authorized to use that particular entity and the data of the users. There are many different healthcare applications. There are many different healthcare softwares like MediSafe, medication management. There's Teladoc, iCare Live, Headspace, Pocket Pharmacist, Health Tab, Medical ID. Medical ID is basically a particular thing which uses all your sufferings of a medical. There's WebMD Baby, there's Skyscape Medical Library, John Hopkins Antibiotic Guide. N number of applications are available inside in the market nowadays, and the most prominent ones are like Health Tab, WebMD, Generis, Pocket Pharmacist, Teladoc, MediSafe Film Minder. All of these applications that are available inside in that particular area of healthcare applications needs to be secure, and it's a crucial aspect of healthcare delivery. And this can be achieved by using the use of access control protocols that are based on blockchain technology. So today's paper, basically, we're going to present a design for blockchain-based access control protocol that is suitable for IoT-enabled healthcare applications. A proposed protocol ensures that only authorized parties can access patient data while also providing an auditable trail of all data accesses. Going further, there's a background that healthcare providers need to share patient data securely and effectively to ensure quality care delivery. Yes, that is a crucial point wherein healthcare providers need to share the data privately and with a very secure formats. However, traditional methods of data sharing, such as emails or fax or phones, to are prone to security breaches and are not efficient. Yes, they are not efficient because there are many man-in-the-middle attacks which can be taking place when sharing a particular patient's data to any other entity apart from the same organization or within the same organization. The emergencies of IoT devices has provided an opportunity for remote patient monitoring. Yes, nowadays you can have an access to anybody's particular IoT enabled emergency devices while you sit at home, and you can take care of a particular patient from a longer distance and making sure that there are no problems with them with the IoT enabled devices such as the diaphragms and everything like that. There are many other kind of IoT enabled healthcare applications and many healthcare related devices which are basically used in many particular organizations in the healthcare. It's used for allowing to communicate with the devices with healthcare providers, allowing better performing, better monitoring and management of time, data, and everything. The IoT devices are wearables like smart sensors and remote monitoring system, and they collect real-time data of patients' vital signs, medication adherence, and activity levels. This data can be used by healthcare providers to diagnose and treat patients more effectively and to provide personalized care plans. IoT is basically booming nowadays in the healthcare application, and the need for IoT in the healthcare application protocols is increasing day by day. And it also reduces the healthcare cost and improve patient outcomes by enabling early detection and interventions for chronic conditions. So IoT is basically a good thing. Blockchain technology is providing a solution to these challenges by enabling secure and transparent data share it among multiple parties. Blockchain technology ensures that data cannot be tampered. Yes, blockchain technologies and the blockchain data can never be tampered by any external entity. It has a succession rate of somewhere around 98% of no tampering and only 2% of tampering if the blockchains are not tightly combined to each other, or maybe there are some few problems at the development level itself, and a decentralized system that eliminates the needs for intermediaries. Yes, it's like a straight patient to doctor and doctor to patient back. No external intermediaries or no middle intermediaries are needed to be having a conversation between any particular two entities within the healthcare organization. So there comes a networking model. It uses a private blockchain in a group of trusted hospitals, where each hospital's authority or the hospital authority receives private and confidential data securely from its authorized registered users using an access control mechanism. As access control mechanisms are used within any particular private entities or the hospital authorities, they receive a private and confidentially data securely. Yes, they do receive it in a data where it is private and confidential. And then the networking model, a group of trusted hospital uses a private blockchain to securely store and share private and confidential data. Like if it's in if a hospital has different organizations which are working, one is working on eye care, the other one is working on kidney dialysis and stuff like that. So the data can be used within that particular organization and be sent within the sub organization with no problems and confidently, and the data is private and confidential. Each hospital has a trusted the it works as a minor node and constructs blocks in the blockchain, with all transactions being encrypted by the hospital's authority. There's a secret key which is used by the hospital authority, public and a private key. No, there's only one secret key which is used by every particular organization, and that particular organization secret key is common only to the sub organizations and not to any other external entity. The key is shared within the hospital's own users as well as other users that are trusted by the hospital authorities, nodes of other hospitals. After transaction on a block are validated and intended verified, can access the confidential and private data of the hospital for diagnostic purposes. Yes, the doctors are allowed and are used to monitor the data of the patient once they are verified within that particular entity and the system. This model ensures securing sharing of data with a trusted network of hospitals, protecting sensitive patient information from unauthorized access. The hospital authorities of each hospital access a minor node and constructs blocks in the blockchain. So once the transactions are validated, and intended verifiers such as the doctor in the hospital can come across the confidential and private data of the hospital for diagnostic purposes of a particular patient sitting at a remote location or maybe far away from the hospital. This model ensures secure and confidential sharing of data among trusted hospitals, facilitating efficient and accurate diagnosis of medical care. Fast, quick, and early to detect. So there's a threat model. The threat model for the proposed networking model using private blockchain is trusted hospital secure includes several potential security risks such as unauthorized access to private data, manipulation of data by malicious actors, DOS attacks, and compromising of the private keys. So there are many particular problems which still the healthcare application faces today, even after having the IoT and the blockchain base. As said, 98% is secure, the other 2% is not. To mitigate these serious, the proposed model incorporates various security measures, including access control mechanism. That's what we are trying to do today. That's what we are talking about, this paper presentation. And encryption of transaction using secret. Yes, every transaction has to be encrypted. And if the transactions are not encrypted, the data can be used by the external entities or the adversaries. Take care of every particular thing that is going on within the organization. And validation of transactions and by trusted parties. The use of blockchain. Sorry. There are several research papers and articles that discuss the threat modeling in blockchain-based healthcare system. Some relevant references include a blockchain-based healthcare system using smart contract by Edson et al. And many other. The design of access protocol. Our proposed access control protocol is based on a permissionized blockchain network where only authorized parties can participate in the network. The network consists of all healthcare providers, patients, and all other authorized parties who can access the data patient's data. So basically, the patient is the most important particular person over here because his or her particular data is going to be accessed by the healthcare providers, the authorized parties within the organizations, the doctors, the nurses, and if required, that data is sent over a secure medium to any other hospital or any other sub-organization of hospitals for a more clear-cut monitoring of the patient's history, of medical conditions. The protocol uses smart contracts to enforce access control policies, which are defined by the healthcare providers. The smart contracts ensures that only authorized parties can access patient data, and all data accesses are recorded on the blockchain for auditing purposes. Yes, the blockchain data uses the auditing purposes, which audits the particular patient's data and makes sure that the patient is going to have any chronic diseases in the longer runs of that particular thing. So IoT enables a faster and a quicker way of analyzing, auditing any particular conditions or any particular signs and symptoms of any longer run disease which can be faced by the patient. One advantage. So there is the registration and the enrollment phase. The registration or enrollment phase is an important step in the access control protocols for IoT-enabled healthcare applications. This phase involves the process of registering and authenticating users, devices, and services that will access the healthcare applications. This basically means that registering all the important entities which are required for auditing the data, auditing the applications, auditing the applications and the data by any external doctor from a remote location. So registration and enrollment phase is the most important phase. During this phase, users will provide these private and personal information such as the name, email, and passwords, which is important. To create an account, the system will then authenticate the user's identity by verifying the credentials, such as the email and password. That is going to be the prominent thing. Similarly, devices and services will be needed to be registered and authenticated to ensure that they are authorized to access the healthcare application. This involves the exchange of cryptographic keys between the device and the service and the application server, which ensures secure communication and prevents unauthorized access. A cryptographic key medium is being created within the devices, the services, and the servers to store the data more securely and more privately and in a nice and a particular manner, which is accessible to each and every particular entity within the organization. Once the registration enrollment phase is complete, access control policies are applied to determine the level of access that users, devices, or services is granted. Every particular the user, the device, the service has a different medium and an interface to take care of, and a different medium and an interface to communicate within the particular organization. These policies may be based on factors such as the user's role, device type, or location. Overall, the registration enrollment phase is a critical step in ensuring the security and privacy of IoT-enabled healthcare applications. By properly registering and authenticating users, devices, and services, the applications can ensure that the only authorized entities are granted access and services healthcare data is provided. Going further, incorporating authenticated transactions and private blockchain formation, the registration and the enrollment phase is a crucial component of access control in private blockchain. The public key is added to the blockchain while the private key is kept secured by the participant. To incorporate authenticated transactions in private blockchain formation, so several factors must be considered. The first factor comes the access control mechanism must be robust, that is sturdy, fast, hard, and enough to prevent unauthorized access to the blockchain. This can be achieved through the use of strong cryptographic algorithms and proper key management practices. The second comes down to the authentication process must be designed to prevent replay attacks and ensure that the integrity of the transaction. This can be achieved through the use of digital signatures and time stamping protocols. Digital signatures are important. There should be time-stamping protocols, which provide a secure way to verify that the authenticity of the transactions and prevent tampering. The third is privacy concerns must be addressed, particularly in healthcare sectors where sensitive patient data is more involved. The private blockchains can provide enhanced privacy by limiting access to the network and encrypting sensitive data. However, more care must be taken to ensure that the access is granted only to authorized party and that sensitive data is properly secured with the CIA confidentiality, integrity, and availability. In summary, incorporating authenticated transactions in private blockchain formations requires a robust, a hard and a sturdy access control mechanism, a secure authentication process, and an appropriate measure to address privacy concerns more quicker and more faster within the IoT-based organization. With careful planning and implementation, private blockchains can provide a secure and efficient way to process transactions while protecting sensitive data. So while running on two different entities, the application must be sure and secure of making sure that the transactions are being processed in a particular mannerism, and at the same time making sure that the protection of sensitive data is also taken into consideration. When it comes to the security analysis is performed on the proposed scheme to show its resilience against various attacks. So the different attacks are going to be impersonation attack. In this attacks, it involves an attacker pretending to be a legitimate user in order to gain access to a system or a device. In this context of an access control protocol, this could mean an attacker stealing the identity of an authorized user to access sensitive healthcare information. Man in the middle attack can be used to do this. Replay attack. A replay attack involves an attacker intercepting a legitimate message and then resending it to the system at a later time in order to gain unauthorized access. There are many entities and many organizations which have faced these problems in the longer runs. Back in times when they didn't have IoT or blockchain-based and enabled healthcare application security within their own organization. In an access control protocol, this could mean an attacker applying a legitimate authentication message to gain access to the system. Man in the middle attack. A man in the middle attack involves an attacker intercepting the communication between the two parties, that is the patient and the doctor, in order to steal the data or inject malicious code. An access control protocol, this could mean an attacker intercepting the authentication message and altering them to gain unauthorized access to any particular entity. It can be either the doctor or it can be the patient, or maybe trying to remodulate or remodify the data that is sent over that medium to confuse the doctor or maybe to the patient, or maybe ask for authenticated security keys or maybe payment gateway options for the patient to pay the doctor. Maybe that might be an attack scenario. Ephemeral secret leakage, ESL attack. An ESL attack involves an attacker intercepting a session key and then using it to decrypt intercepted messages. So in this, it could mean an attacker intercepting a session key. It can intercept the session key with the man in the middle attack and use it to gain access to the sensitive healthcare information. Not only the patient healthcare information. When the attacker has got the particular session key, that particular attacker can use that session key to get into the session informations with the doctor's entities as well and the patient's entity. Anonymity and untraceability. Anonymity and untraceability are important consideration in any access protocol. Anonymity ensures that user identifiers are not revealed to unauthorized parties, while untraceability ensures that the user actions cannot be traced back to their identity. No backdoors are created, nothing as such. This helps to prevent attacks such as impersonation, replay, and man-in-the-middle attack. Going further, benefits of the proposed protocol. Our proposed access control protocol provides several benefits over additional methods and data sharing. Firstly, it ensures that the patient's data is secure and cannot be tampered with. Secondly, it provides an auditable trail of all data accesses, which helps to maintain accountability and transparency. Yes, proposed access control protocol provides several benefits over traditional methods of data sharing, and it makes it very much pretty clear for anyone to understand that it ensures the patient data is secure. And once the patient has gotten confirmation and even the organization has gotten information about that the data is secured and the data of the patient and the data of the organization is secured, then there are no proposed protocols available that might be that might get tempered or anything as such. Going further with secondly, it provides an auditable trail. Yes, when it comes going back to firstly, it ensures that the patient data is secure and cannot be tampered. Yes, there is a particular organization of increased efficiency. A good protocol can help streamline process and reduce the time and resources. Enhance security. So a robust or a sturdy protocol can improve security by ensuring data integrity, confidentiality, and authenticity. Interoperability, a protocol that adheres to open standards and facilitates interoperability between different system devices and platforms, enabling seamless communication and data exchange and making sure that the healthcare provided or the healthcare information within the organization is safe and secure. Scalability, reliability, flexibility. It is also cost saving as well at the same time. Thirdly, the use of blockchain technology eliminates the needs for intermediaries. It's straight up a patient and a doctor talking to each other within that same particular model. The challenges and the future work includes a lot of things. I'm sorry. Yes, the implementation of a proposed access control protocol faces several challenges, including the need for standardization of access control policies and the development of user-friendly interfaces for healthcare providers and patients. Yes, the UI and the UX designs for This particular access control based protocol needs to be more precisely nicer and user friendly. So the challenges and the future works includes that it has to be an integration of artificial intelligence and machine learning algorithms to improve the accuracy of access control policies, and making sure that the interfaces are user friendly so that the user has got a good idea about it, and scalability, and yes, and the development of interoperability standards to be enabled, enable seamless data sharing across different healthcare system. Yes, when it comes down to challenges in the futures, there might be a rise in implementing the proposed protocol and the future steps that can be taken to address these challenges and to improve the protocol. Some common protocol challenges and future works are related to security and privacy concerns. One of them biggest challenge for any protocol is to ensure that the security and privacy of user data. In the case of IoT based protocol, is even more important that the data is collected from multiple devices and can be vulnerable to cyber attacks. Future work in the area could focus on improving encryption techniques, implementing secure data transfer methods, and creating more robust and authentication mechanisms. Then comes down to the scalability. IoT devices are becoming increasingly popular and are being very used in very various industries like healthcare applications and any other industry. This makes scalability a significant challenge for IoT protocols as they need to be able to handle the large volume of data generated by these devices. Future work in this area could include developing more efficient data management techniques, improving network infrastructures, and utilizing edge computing to reduce the load on central servers. Interoperability. IoT devices come in various forms and are built using different techniques. As a result, ensuring the interoperability devices between devices and protocols can be a significant challenge. Yes, future work in this area could focus on developing standardized communication protocols and creating more flexible and adaptive systems that can work with a variety of devices. Power management. Yes, power management. Many IoT devices are battery powered. Yes, most of the devices within the healthcare area or healthcare scalabilities are battery powered, and the protocol needs to be designed to minimize the energy consumption. So when you are accessing that particular device from a longer run or a remote particular place, the battery consumption increases and it makes them drain faster. So the need of IoT food inside in this area and the challenges and the future work will increase of reducing the devices with the battery powers. Future work in this area could include improving power management techniques, developing more energy efficient devices, and utilizing renewable energy sources to power IoT devices. Real-time data processing. Many IoT applications require real-time data processing, which can be challenging due to large volumes of data generated by devices. Future work in this area could focus on developing and more efficient data and processing algorithms and utilizing machine learning techniques to improve the speed and accuracy of data processing. As nowadays, all we know, artificial intelligence and machine learning has made it very pretty clear and very much easier for any particular organization to work without much of load workforces. So overall, the challenges and future work related to IoT protocols are numerous, and addressing them will require ongoing research and development. So every time you face a new problem, or every time any organization is going to be facing a new problem, that particular problem is going to be a new way of researching and developing a particular protocol which will overcome that particular problem. However, focusing on these challenges and working to improve the protocol, we can create more efficient and more effective IoT systems that can improve our lives in countless ways. So the betterment of that particular thing depends on what. To conclude, the integration of blockchain technology and IoT devices provide a promising solution to the challenges, also making it very pretty clear for everyone. And I'm missing something. Yes, yes. Yeah. So when we come forward, so in conclusion, to conclude, there are many analyses that take place before this, and those are as follows. So the security analysis is basically done. There's encryption, access control protocols, and stuff. There are different attacks which take place to them. And going forward, yeah, there comes a comparative analysis and access control protocol. A comparative analysis can be performed on various access control protocols for IoT-enabled healthcare applications. Some of the access control protocols used in the healthcare application nowadays are role-based access control protocol, that is the RBAC. So RBAC is widely used access control protocol in healthcare application. The most prominently used, it provides access to resources based on predefined roles assigned to the users. That is the ABAC, that is the attribute-based access control protocol. And on the other hand, uses attributes of users and resources to determine access control protocol decision. That is a CBAC, that is a context-based access control protocol. It is a more advanced access control protocol that takes into account the context in which a resource is accessed to make control access decisions. Going further, the RBAC is relatively simple to implement, but it lacks the flexibility and granularity of ABAC and CBAC. ABAC allows for more granular access control decisions, but it requires a more sophisticated infrastructure, a more sophisticated system, or a more secure system, or a system which is not having many sub organizations to manage attributes. CBAC is the most flexible access control protocol, but it also requires the most sophisticated infrastructure to manage context based policies. That is the CBAC. Overall, coming down to a conclusion that the choice of access control protocol depends on the specific requirements of the healthcare application. For applications that require simple access control decision, RBAC must be sufficient. Or for applications that require more granular access, then the control decision ABAC may be the best choice. For applications that require context aware access control decision, CBAC be the most appropriate choice. And looking forward to why CBAC is the most appropriate choice, it is because CBAC is a type of an access control mechanism in use in the Cisco routers. Cisco being one of the most secure access control mechanism user and provider. Fine, finer grained control over network traffic. It allows administrators to define policies based on the context of a network connections such as the source and the destination IP address ports and protocols. CBAC allows works by creating temporary openings in the router access control list ACL to allow return traffic for specific connection. It uses stateful inspection to keep track of the connections and can dynamically create and remove ACL entries to allow or deny traffic. CBAC is particularly useful for securing traffic in situations where traditional access control mechanisms such as the port-based access control mechanisms, that is ACLS, are not sufficient. And it provides a more granular level of control over network traffic and then can help prevent unauthorized access and potential attacks. So to conclude, the integration of blockchain technologies and IoT devices provides a promising solution to the challenges of data security and privacy in the healthcare application. A proposed access control protocol ensures that the only authorized parties can access patient data while also providing an auditable trail of all data accesses to make sure that they have traces of every particular data that was accessed by either the patient or by the doctor or by any other healthcare organization with which their data was shared. The proposed protocol provides several benefits over traditional methods of data sharing and is scalable to accommodate a large number of healthcare providers and patients. Future work includes addressing the challenges of standardization and user friendliness and integrating advanced technologies like AI and machine learning inside of this. This paper attempts to address an important security services need for IoT-enabled healthcare applications in this case. We designed a new access control mechanism with the help of private blockchain technology in a trusted group of hospitals for sharing securely the private and confidential data. We applied ECC-based signature approach in the proposed scheme. The security of the proposed scheme is dependent on the solving of ECDLP and the collision resilient one-way hash function. The proposed scheme can resist different known attacks such as in section 4. Furthermore, the proposed scheme preserves both user anonymity and untraceability property. Finally, it was shown that the proposed scheme achieves better security and requires low communication and computational overheads for IoT enabled. There are many mathematical organizations helping on this. So this presentation was in regards with the paper proposed by Saurav Saha, student member IEEE, Anil Kumar Sutralat, Ashok Kumar Das, senior member IEEE. The title was Chain of Health, a blockchain-based access protocol for IoT-enabled healthcare application. Thank you.